If you look here, the compression was here, look in the head, is little, this was full and was extended, is little better in the side here, you see that? Was much more full. Here is little full. I'm gonna show you the techniques how to take this fullness away. Move down, brother, move down, please. Okay guys, there's a small hole in the skull here, behind the ear, here. I'm gonna put one finger in the hole behind the ear here, and I'm gonna turn this, I'm sorry brother, yes. It hurts you a little bit, yes? Yeah. It hurts when I twist. I'm gonna fix the rotation, I'm gonna do like little legs for him. I'm doing this here guys to, this is called, I'm emptying, I'm vacating the transverse sinus. This transverse sinus, release the congestion of transverse sinus. I keep this for 1 minute. I'm going to take the advantage of being here. Be sure to fix the craniosacral rhythm. If they don't know the cranial, later on I'm going to teach you the cranial guys. It's kind of the cranial technique. This is keep it for 60 seconds. I'm going to go to the other transverse process, other transverse sinus, empty the contra transverse sinus as well. Here. Okay. What else I can do here? I'm gonna go in an occipital condyle. Look at me here. This little finger is an occipital condyle of each occiput. Look at my hands here. Forearm should be rested. And look here, just forearm should be rested on the table. And you're gonna approximate your elbows. Sorry, this is here. The little fingers on occipital condyles, the medial aspect. And just approximate your elbows. See like this? Look at my fingers and my elbows. Just approximate your elbows. No force. You just put your little finger like that on the medial aspect of occipital condyles of both sides and approximate your elbows. Your elbows approximation. Elbows approximation. You see that? This is called, you're gonna release the foramen magnum a little bit. Go down, my brother. Okay, we have the dura mater. The dura is relax, brother. Just relax, fully relax, please. Go a little more down, please. Okay, fully relaxed now, my brother. See, guys, I have to be sitting comfortable. My forearm is in a table fully. Sorry, my paper that cover it keeps tearing. I know that. Okay, just 1 second. Sorry for the appearance. Let's work with very practical people. For me, the left now, because I released did the position of the release for the right side, so the left occipital condyle for me is a little tight. The dura, wraps the foramen magnum. And the dura has holes for all the cranial nerves and major nerves. So just 1 second here, I'm gonna do this. Okay, for me, the occipital condyle is more resilient, more flexible, more coming with me than the left one. So I may need to release the left one first, but this is a foramen magnum release. This is gonna help, emptying the fullness of the head, and you're gonna, enhance the passage and the flow of the craniosacral fluid, the cerebrospinal fluid, the cerebrospinal fluid, the CSF, foramen magnum opening technique. Okay, now, believe it or not, the left occiput is also released a little bit with me. It's not as before with the stretch. You do this for 1 minute. And here again, I'm with my little finger medial to the medial aspect of the occipital condyles, and I'm going to do little opening, closing my elbows together, approximating my elbows, and keep this. Okay, how do you feel, my brother? Good? Okay, now I released it. It opened with me. The two occipital condyles are much wide as this. It's opened. You can feel it. The occipital condyle come with you, open with you. Every bone in our body is movable, and we can move them, you can manipulate them. Okay, if you like the video, press like, please subscribe. If you have any question or comments, write it down. I know many people could be the cranial is new for you. I do teach cranial therapy if you want. It works wonderful. It's amazing. Cases of headache, for all the cranial nerve issues, for body people who are lazy, who doesn't have enough energy, cranial might help. Cranial help also the academia for the students. They do wonderful. I got so many patients. Actually, his daughter was, I don't know, I should speak or not. I have to take permission first. Okay, I have one of the kids, she didn't get 50% in math after doing the cranial therapy with me. She got 95 or 900 just by doing cranial therapy. To help the academia. You want to talk about it or no?
Not yet.
Okay, no. Okay, and it helps also the emotional and behavioral. I got a new immigrant mother, um, coming from Middle East, and her son. She walked into the office with a letter from the school that her son is misbehaving, and the school has to dismiss him. She has to find another school for him. But I told her bring him here, and she told me that he doesn't pray, doesn't want to go to the Quran classes. They were Muslim, and said her father get mad at him. I told her bring him here when I check, maybe he's sick. As soon as I checked his head, he had bizarre cranial rhythm. I told him your son is sick. He was walking abnormal. Has got a couple of visits actually. He got normal. She came back to the office, and after a couple of visits with a letter from the same school, instead of saying we need to dismiss him, your son's behavior is good now and we're going to keep him in the school. And she told me that her son tell her, remind me where the Quranic class is, remind me where the prayer time is. Just behavioral, so don't beat the kids, guys. They could be sick. And the proof for that, doctor, we have Dr. Abdelrahman work and all the cranial therapists worked before, many scholars. But in Dr. Daniel Amin book, that a happy 16-year-old girl was riding her bike in a park, and her head hit a tree branch she didn't see. After that, she became suicidal. So I want to tell you here that the brain is like the hardware, emotions, behavior, and feelings are the software. And if you change the hardware, you can change software. Change software, you can change hardware. But it's easier if you can change the hardware and change the software, which is the emotion behavior. Look at my brother's head here now is less full. Look here, is less full. Now look at this. This was too like inflated. Was like this when it was congested. He now is not as congested, much better than before. See, now this was too in, this was too out, and look at here too, the same. So this actually cranial work, if you have congestion in your head, can cause the headache. Could be cerebrospinal fluid, could be a venous blood. That's why we did the transverse sinus release and the foramen magnum opening. Okay, again, leave your comments, stay tuned. We're gonna give you live cases from my clinic every day. Bye. Dr. Salem from Brooklyn, New York.